I am Dr. Murli, Chief Surgical Oncologist in CION Cancer Clinics. Today I will be talking about bladder cancer. Bladder cancer awareness is the need of the hour, as nowadays the incidence of bladder cancer is increasing, especially in urban areas, although it is still relatively a rare cancer, mainly occurring in elderly people. Bladder cancer is a cancer which occurs in the lining of the bladder and usually occurs in elderly people. It is associated to some extent with alcohol and smoking. There are other factors which are not very clear, but these are the two avoidable factors. Other than this, they usually present with pain during passing urine, or burning in the urine, or passing of blood in the urine, or pain while passing urine. These are the main symptoms of bladder cancer. Sometimes massive bleeding in the form of lots of blood or clots can occur, and the clots can block the urine passage, causing difficulty or inability to pass urine with pain. In such cases, it is an emergency and the patient must be rushed to the hospital. However, any patient who is having unexplained burning of the urine for several days to weeks, or having reddish discoloration of the urine, or sees some amount of blood coming in the urine, should immediately get evaluated by a doctor, either a physician or a surgeon. Even a urologist, a specialist in bladder and kidney diseases is also preferred. The first investigation usually done is a urine investigation. They will see the urine for any blood or cells. Sometimes cancer cells can be seen in the urine itself and the diagnosis is made. After this, we do what is called a cystoscopy, an endoscopy examination of the bladder under local anesthesia with a light, and we see if there is anything inside the bladder. If any tumors or abnormal areas are there, a biopsy is taken. A biopsy means a small piece of tissue which is removed and sent for testing. The testing is basically a pathology examination. Once the pathology examination confirms that it is cancer, then further tests like CT scan, ultrasound, and PET scan are done to see the stage of the disease, that is to see whether the disease has spread anywhere else. Based on these findings, the doctor will then decide, the cancer specialist will then decide as to whether radiation is to be given first, or chemotherapy first, or surgery first. In early disease, surgery can be given and tried. In advanced disease, usually first radiation or chemotherapy are tried and then surgery is planned if there is good response to chemotherapy. Sometimes if the tumor is very advanced, then there is not much which can be done in the form of curing the patient, but still some form of surgery and some form of chemotherapy and radiotherapy can be given to decrease the symptoms and prolong the life of the patient. So awareness of bladder cancer again is the most important way to be able to control this disease. Thank you.